everyone, welcome to GoLocal Live, the Navigant Credit Union Broadcast Center. I'm Molly O'Brien. I'd like to welcome Joseph Wendelken from the Rhode Island Department of Health. Joseph, how are you doing today?
I'm good. How are you?
I'm doing well, thank you. I'm
good.
Fairly healthy. How about yourself?
Hanging in there.
Okay, good.
Yeah.
So last week, the CDC stated in a report that there was widespread influenza activity reported in 7 states, and Massachusetts was one of them. In that same report, Rhode Island showed minimal activity, and I was just checking on that report, and they were saying that Rhode Island showed some sporadic flu activity reported as well. So we wanted to bring in Joseph today to talk about the current state of influenza in our state, as well as how we get these reports and how you can keep yourself safe and healthy as we continue through the holidays and then some. So Joseph, let's first of all talk to you a little bit about what we need to know about the flu season in Rhode Island this year.
Yeah, so every single year the flu viruses that are circulating in Rhode Island change. So that's why it's very important that everyone gets a flu shot every single year. Even if you got a flu shot last year, that's great for last year, but it's not going to protect you this year because the flu viruses circulating in the state are different. So again, everyone older than 6 months of age should get vaccinated every single year.
Okay, so that's number one on the list. So let's talk a little bit about that. We were chatting just a moment ago. So in Massachusetts, they were saying it's widespread. And then here, the report from the CDC was saying that minimal, and now we're looking at sporadic. So the Rhode Island Department of Health, I was digging in, has a ton of data.
Yeah.
And you can go down a rabbit hole on the data. I mean, there are spreadsheets available. There's all kinds of data available on that. And there are different stages of reports on the different stages of influenza, how you kind of classify it. Can you talk to me a little bit about what all this data means, how you collect it, and how it's useful?
Yeah, so we're fortunate to have a wonderful team of epidemiologists at the Rhode Island Department of Health. And what they do is they track the amount of influenza-like illness throughout the state. So as you said, we're at the sporadic level right now. So to give you a sense of what that means, there are 5 tiers that we use to rank the amount of flu activity that we're seeing throughout Rhode Island. So the bottom one is no activity. The second is sporadic activity. Then there's local, regional, and then widespread. So right now we're at the second lowest tier of those 5 tiers. The way that we get that number is that we work with what we call Sentinel Sites throughout the state. So there's a lot of flu throughout Rhode Island every flu season. So instead of collecting data on every single flu case at every single healthcare facility throughout all of Rhode Island, we have a small collection of healthcare facilities and healthcare providers that report to us. And then using those numbers, we make a projection about what kind of flu activity we're seeing throughout the whole state. So again, using the data that we get from those Sentinel sites is how we determine what tier of flu activity we're at. And again, right now we're at sporadic.
Okay, so as we move forward, from my understanding, the flu season goes from October to May. Is that correct?
Yeah, so
sort of.
It's a little bit hazier than that.
Okay.
We tell people that they should start getting vaccinated at the end of September, early October.
Okay.
And then in terms of when flu season ends, it really varies. We tell people that if you haven't been vaccinated before the beginning of spring, it's a good idea to get vaccinated. So if people haven't been vaccinated yet, there's still plenty of time to go out. You get vaccinated now, you're going to have several months left of protection for the remainder of the flu season.
So now is a good time to get vaccinated if you haven't already been vaccinated.
If you haven't been vaccinated yet, now is the best time. Yep.
Okay.
Now, just to add one other thing, now is actually a really good time as well because it takes about a week after you get the flu shot for your body to really build up that defense and be ready to fend off the virus if you're exposed to it, which is good because for a lot of us over the next couple weeks, we're going to be getting together with family, with friends. Some of us are going to be traveling. So it's going to be a good way to protect yourself. You don't know if a grandma, grandparent, cousin, someone you're seeing is going to have the flu. It's also really important because when you get a flu shot, you're not just protecting yourself, you're also protecting the people around you by preventing the spread of the flu. And sometimes those are people who are a little bit more vulnerable to the health impacts of the flu. People with chronic medical conditions, the elderly, young children, all of these people are really vulnerable to the effects of the flu. So again, by getting a flu shot, you're not just protecting yourself, you're also protecting the people around you in your life.
Which I think is a super critical point because, like you said, as we head into that holiday season, a lot of people are going to be traveling, you're going to be gathering around people who may be sick, or you might then you're probably going to be interacting with a lot more people at holiday parties and just out and about. You could be headed to the airport, which, who knows? You don't even want to think about that with all the germs.
Yes.
Which kind of brings me to my next point. You know, there was a lot of there was a lot of discussion in the news about how flu season kind of hit early in Massachusetts, and there was a lot of activity, which kind of got me thinking. You know, we're very close regionally, geographically to Massachusetts, and of course, a lot of people commute for work, childcare. There's a lot of interconnectivity with Massachusetts. Does that have any bearing on what, you know, maybe flu season is like in Rhode Island, or do we have to consider that, or do we not really think of it in terms of that?
Yeah, so people should definitely be aware and know that there is a lot of flu activity, even if right now in Rhode Island we're only at that sporadic level, that in the region there is a lot of flu virus circulating, which means that if someone has not gotten vaccinated, it's really, really important that they go out and do that. Okay,
so it's something to bear in mind.
Yes.
Okay. So let's continue the conversation by what we need to think about maybe long term with the flu, because we're looking at vaccines and they change every year, right? What do we have to think about when it comes to long term with the flu, do you think, in terms of Rhode Island health?
Well, so the good news here is that Rhode Island is actually one of the best vaccinated states in the country. Last year, about 450,000 people got flu shots in Rhode Island. Which is when you look at the percentage of people, or the number of people in the state who are eligible to get flu shots, it worked out to be about 55%, because people younger than 6 months of age shouldn't get vaccinated, and there's some people with some very specific medical conditions that shouldn't get vaccinated. So generally speaking, about 55% of people get flu shots every year in Rhode Island, which when you look at, hold us up against other states in the country, is one of the best vaccination rates in the nation. So big picture, Rhode Island does very well when it comes to flu shots. Of course, there's always room for improvement. There's still a sizable chunk of people who, for one reason or another, don't get flu shots, and that's why we're working hard at the Department of Health to really get the message out about the importance of flu shots. It's easier now than it's ever been to get a flu shot. I mean, I don't think you can walk down the street without seeing a sign at a pharmacy or somewhere else telling you to come on in and get your flu shot. So, you know, no appointments are needed in a lot of those at a lot of those sites. So again, it's really easy, and we've worked throughout the state to make it easy as possible. If people don't have health insurance, if people can't afford flu shots for one reason or another, they can always reach out to the Department of Health, and we can connect people to clinics where they can get vaccinated at no cost. People can call the Department of Health at 401-222-5960 for that information.
Yeah, and I do think it's pretty impressive, the accessibility that the Rhode Island Department of Health is making it for people who either maybe don't have insurance or just accessibility-wise, there are clinics and that kind of thing. Has that been a point of interest, just making sure that there is accessibility for people?
Absolutely. So that's one of our top priorities at the Department of Health. It's one of Dr. Alexander Scott's top priorities. Dr. Nicole Alexander Scott is the director of the Department of Health. A real priority for her is ensuring access to quality health services and care for everyone throughout the state, no matter what zip code they live in, no matter their ability to pay for that care, afford that care. So for that reason, we've really worked hard to make flu shots as accessible as possible. That's actually really a legacy of a program that we started several years back. I don't know if you recall when H1N1 was in Rhode Island, and that was the first year we really stood up. We stood up a program of school-located flu clinics, so that's something that we've continued ever since. So the last school-located flu clinic is tonight, so unfortunately for a lot of people, if they wanted to get vaccinated, they've probably missed that opportunity, but it's a program we're going to continue next year. And basically what we offer there are flu shots to anyone in that school, but also family members, friends, anyone in the community. It's really intended to be a community event, to be an option for anyone in that city or town who wants to come in and get a flu shot.
Okay. as we continue to move forward, and we talked a little bit about the kind of this legacy of making accessibility a priority and such, but as we continue to move forward, what do you think the message is for people as we try to combat influenza?
Well, so the first thing that people should do, and I probably sound like a broken record at this point, is to get vaccinated. It really, really, really is the best way to protect yourself against flu shots. There are other things that people can do, like washing their hands regularly, for example. If someone is coughing or sneezing, to cough or sneeze into your elbow to help prevent the spread of germs. Another really good thing that you can do is, if you are sick, to stay home. Stay home, get rest, take care of yourself, and by doing that, you're not only helping yourself, but you're also helping to prevent the spread of illnesses in your workplace or at school or elsewhere. Nobody wants to get the flu.
No.
It's something that we say often at the Department of Health is that it's not just a runny nose, it's not just a cold. If you have the flu, you're usually in bed for about a week, sometimes more. That's a week out of school, a week out of work, a week looking for a babysitter or a child care provider because your child is out of school. So it's really, really it's really a difficult situation for a lot of people, and it's also medically serious. Last year we had 33 people in Rhode Island who died from the flu. We had many, many, many hospitalizations because of the flu. So it's definitely a serious, serious virus.
And that's what, as we move forward, trying to say, what can we do? How do we prevent this? Because it is serious. Some people think, oh, flu, I can get a flu shot, whatever. But, 33 people dying is no joke.
Exactly.
All right. Well, Joseph Wendelken from the Rhode Island Department of Health, thank you so much for coming in here today to talk a little bit about the flu and what we can do to prevent it, and just kind of Rhode Island's, the Department of Health, take as we move forward into the flu season. So thank you so much for joining us. I really do appreciate it.
Of course, it's a pleasure.
Happy and healthy holidays
Thank
to
you.
you.
Thank you, you too.
All right, everyone, please hang tight as we get set up for our next guest here on Go Local Live.